Hello, I'm Dr. Patrick St. Pierre, and I'm the Chief of Sports Medicine and Orthopedic Research here at Desert Orthopedic Center. I'm also currently the Chief of Orthopedics at Eisenhower Medical Center. As a shoulder and elbow surgeon and specialist, I get to see a lot of shoulder pain. And primarily shoulder pain derives from either inside the joint, which is arthritis, or from the rotator cuff, which are the tendons that surround the shoulder and help that shoulder function. And that's really the most common thing that we see, is either a tendinitis of the rotator cuff, a tear of the rotator cuff, or surrounding bursitis that involves that shoulder. The rotator cuff has four muscles that surround the shoulder. So there's a front muscle called the subscapularis, there's the supraspinatus on top, and in the back there's the infraspinatus and teres minor. And those four muscles surround the shoulder and make up the rotator cuff. Now the rotator cuff does rotation, and that's where it gets its name, but also its main function is that when people are raising up their arm, they'll keep that ball centered in the socket and allow clearance up here. So when people have rotator cuff problems, whether it's tendinitis, bursitis, impingement syndrome, or rotator cuff tears, the rotator cuff doesn't function the way it's supposed to, and when people are raising it up, this bone impinges up here on this bone, and that's called impingement syndrome. And that's what causes the pain, and also the decreased range of motion. When people are trying to raise their arms up, it pinches up here, and that pain keeps them from full motion. Treatment of rotator cuff problems is often a multifaceted treatment program. We start first by trying to stop the pain. So we often use corticosteroid injections in and above the shoulder into the bursa, or also some patients will take nonsteroidal anti-inflammatory drugs or other ways of decreasing the inflammation and taking away the pain. For patients who have rotator cuff tears, if it's a very small tear, there are some patients that don't need to have surgery. If a tear is large enough that it's going to progress and the shoulder is not functioning correctly, an operation or rotator cuff repair is often necessary to restore that function of the rotator cuff muscle. So for most patients, a full rehabilitation from a rotator cuff repair may take 4 to 6 months before they're able to do all those activities that they wanted to do, including tennis, weightlifting, and golf. We try to avoid overhead weightlifting, such as military presses and incline presses, because that tends to aggravate it. And one of the things that's not as reliable as anything else is how much strength that they get after their surgery. A lot of it depends on how bad the tear is and how well the patient works with their rehabilitation.